Okay, good evening, guys. This is discussion D for you all. We're discussing the rising cost of long-term care for seniors in the U.S. So here we go tonight for our discussion D. Please join me in tonight's discussion, which I pieced together for you. Okay, so here we go. The text highlights a concerning trend regarding the rising costs of long-term care in the United States and the lack of financial preparedness among Americans. According to the surrounding page content, a study by Glenworth predicts a 66% increase in assisted living cost over the next decade. This is particularly alarming as 10,000 baby boomers turn 65 daily until 2030, creating a surge in demand for long-term care services. The growing financial burden underscores the urgent need for individuals to plan and prepare for these expenses to avoid potential challenges during retirement. Okay, folks. The rising cost of long-term care have significant economic implications. Okay, increased financial strain on households. Families may face higher out-of-pocket costs, expenses, leading to reduced disposable income and potential financial insecurity. Okay. Pressure on government programs. Public programs like Medicare, Medicaid may experience increased. Hold on, there's 3 pages, folks, so bear with me, please. Just a minute. Okay. Increased demand, potentially straining budgets and requiring policy adjustments. Impact on employers. Employers might see higher health insurance premiums and productivity losses as employees juggle caregiving responsibilities. Okay, then you've got economic inadequate ability. The rising costs could disproportionately affect lower income families exacerbating economic discrepancies, healthcare, senior growth. On a positive side, the demand for long-term care services could stimulate job creation and growth in the healthcare industry. These trends highlight the need for comprehensive planning and policy reforms to address the challenges posed by escalating long-term care costs. The impact of rising long-term care costs varies significantly across income groups. Low-income families, these households often rely on government programs like Medicare or Medicaid to cover long-term care expenses. However, limited access to hold on. Limited access to resources and eligibility restrictions can leave them vulnerable to financial strain. Middle income families. This group faces the greatest challenge as they may not qualify for Medicaid but still struggle to afford private long-term care services. Many middle income families, despite their savings or assets to cover these costs, higher income families, whether wealthier households are better equipped to manage long-term care expenses, often utilizing private insurance to personal savings. They are less likely to experience financial hardship due to these costs. The this partial in how income groups handle long-term care expenses highlights the need for policy reforms and financial planning to ensure adequate access to care. You can explore more about this at msn.com, folks. For now, Gator Wellness, take care.